So you're coming in tomorrow for your cervical disc replacement. What can you expect? Well, the first thing is I would try and get a good night's rest so you're ready for the surgery. I would try to avoid anything after midnight in terms of eating or drinking. It's okay to take medications if you need them with a small sip of water, however. When you arrive, you'll be checked in by the preoperative nurses and prepared for surgery. Once you get to the operating room, the first thing we'll do is have the anesthesiologist put you off to sleep. We'll then begin the process of spinal cord monitoring. This is another doctor that will be monitoring the function of all the nerves while you're asleep to make sure everything is done safely. With a cervical disc replacement, patients usually go home the same day. Sometimes if the case is done later in the afternoon, I'll have them spend the night at the surgery center and then they can go home the next morning. For the first 24 hours after the surgery, most patients do have some discomfort, not so much where the incision is in the front, but more in the joints in the back of the neck from us sort of realigning the neck and putting in spacers to restore the normal anatomy. And that can put some stress on the muscles and ligaments and cause some soreness. Things like ice and a muscle relaxer as well as pain meds help a lot with this. The other thing I would encourage you to do the first couple of days is stay upright as much as possible. Gravity is really our best friend with this type of surgery. It helps all that swelling go down, and that helps decrease the pain and also makes it easier to swallow after surgery.